The unspoken risks of neglecting intimate health. After 60, a gynecologist's perspective. Have you ever found yourself whispering in a quiet moment, perhaps at my age, intimacy simply does not matter anymore? Or maybe you have silently come to accept the discomfort, the pervasive dryness, or the gradual loss of desire as just another unavoidable sign that the years are indeed passing by. If you have ever had those thoughts, I want to ask you to pause and stay with me for a moment, because the profound truth of the matter may genuinely surprise you. Ignoring your intimate self-care after the age of 60 is not only about missing out on the potential for closeness with a partner, it can quietly and insidiously put your overall health at risk in ways that most women never even realize. I am Dr. Lily Stones, a gynecologist who has dedicated more than 3 decades of my life to listening to, supporting, and guiding women through every single stage of their journey. And if there is one singular, overarching lesson I have learned, it is that intimacy is not just about the act of sex. It is fundamentally about healthy circulation. It is about hormonal balance. It is about the strength and resilience of your tissues. It is about your confidence, and it is about your ability to feel completely at home within your own body. When women allow this vital part of themselves to go unattended, the body invariably begins to send out signals. Sometimes they are subtle, and sometimes they are loud, that something essential is missing. I will never forget Carol, a 72-year-old woman who sat across from me in my office, her hands folded neatly in her lap, speaking softly about her blood pressure medication. But when I gently inquired about her overall well-being, she admitted something that she had not told a single soul. She had completely stopped all forms of intimacy years ago because it had simply become too painful. She genuinely believed that she was protecting herself by avoiding what felt uncomfortable. What she did not comprehend was that, as a result, her tissues were progressively thinning, her local circulation was slowing down, and her risk of developing infections was steadily climbing, all because she had stepped away from the very self-care that her body still desperately needed. Carol's story is far from being unique. Extensive research from both the Mayo Clinic and the National Institutes of Health, NIH, confirms what I witness in my own office every single day. Women who neglect their intimate self-care after menopause face significantly higher risks of urinary tract infections, pelvic floor weakness, circulatory problems, and even profound emotional struggles such as low self-confidence or a deep sense of isolation. The body interprets this absence of care as a form of neglect, and the consequences of that neglect ripple outward, impacting health in areas far beyond the bedroom. Think of it in this way. You would never consider stopping the practice of brushing your teeth just because you turned 60. You understand that proper dental care is not about vanity. It is about preventing infection, protecting your heart from related complications, and preserving your fundamental ability to eat and to smile with complete ease. In precisely the same way, intimate self-care is not optional. It is not a luxury. It is an integral part of keeping your entire body strong, resilient, and vibrantly alive. Over the next few minutes, I am going to guide you through the 3 hidden dangers that often appear when women over 60 cease to care for their intimate health. We will talk about the science behind what is happening deep inside your body. We will explore the small, everyday steps that can effectively restore your circulation and your confidence, and I will share the inspiring story of another woman who thought that intimacy was gone from her life forever, until she discovered a different and more hopeful path. By the end of this video, you will know exactly why your intimate self-care is so critically important and what you can do to protect yourself, starting today. But before we dive deeper, I want you to take a moment and reflect. When was the last time you truly thought about your own intimate health? Not for the sake of anyone else, but purely for yourself. Was it last month, last year, or perhaps never at all? I would be honored if you would share your thoughts in the comments section, because your voice might just be the very encouragement that another woman needs to finally start caring for herself again. So let's begin this important journey together. And I promise you this, it is not about turning back the clock. It is about honoring the incredible woman you are today, protecting the precious body you live in, and giving yourself the invaluable gift of vitality, confidence, and freedom for all the years to come. Many of the women I meet in my practice believe they are protecting themselves by quietly and gradually stepping away from all forms of intimacy after the age of 60. They make the assumption that it is safer to avoid it altogether than it is to face the discomfort of dryness, the perceived awkwardness of change, or the fear of potential embarrassment. But what often begins as a silent personal decision to simply ignore intimate self-care can eventually unfold into a series of health problems that are far more difficult to manage. One of the most common and pervasive mistakes is thinking that intimacy no longer holds any relevance after menopause. When your estrogen levels naturally decline, the tissues of the vagina and the surrounding pelvic area become thinner, less elastic, and significantly more fragile. Without any form of regular stimulation or dedicated self-care, these delicate tissues are effectively starved of healthy circulation, and as a result, become even weaker. I remember June, a 68-year-old widow who confided in me that she had not been intimate in any way for many years. She came to see me not because of any concerns about intimacy, but because she was suffering from recurrent, debilitating urinary tract infections. What she had not realized was that by completely stepping away from her own self-care, her body had become far more vulnerable to such issues. Her tissues had weakened to the point where even simple, everyday activities like walking long distances or sitting for extended periods of time were leaving her feeling profoundly uncomfortable. She had thought she was avoiding harm, but in truth, she was inadvertently exposing herself to a much greater risk. Another frequent mistake that many women make is dismissing vaginal dryness as just an inconvenience. I often hear patients say, "It's uncomfortable, but I suppose I can live with it." What is so often misunderstood is that dryness is not merely about discomfort. It is a clear warning sign that your circulation has been reduced, that the supportive effects of estrogen have faded, and that your tissues have become fragile. If left untreated, this dryness can lead to the formation of micro tears, painful inflammation, and can even cause women to avoid necessary medical examinations. I recall one patient who had avoided her routine pap smear for 3 full years, simply because of how uncomfortable she felt, only to discover later that she had an early precancerous condition that could have been caught much sooner. Ignoring dryness is much like ignoring a small but growing crack in the foundation of your home. It may look minor at first, but over time it can cause serious and widespread structural damage. There is also the silent neglect of the pelvic floor. These incredibly important muscles are responsible for holding up your bladder and uterus, and they even play a significant role in your posture and your sense of balance. Yet a great many women stop exercising them after the age of 60, operating under the false belief that pelvic care no longer matters. What often follows is the onset of urinary leakage, a reduction in physical sensation, and even a significant impact on their daily confidence. Mary, a 70-year-old grandmother, confessed to me that she had begun to avoid family outings because she was so deeply embarrassed by the possibility of sudden leaks. She had simply accepted this as an unchangeable part of aging. But when she learned how to gently and consistently activate her pelvic muscles, her entire life was transformed. Within just a few short months, she was able to laugh wholeheartedly with her grandchildren without a single moment of fear. The mistake was not her body, it was the pervasive and debilitating belief that nothing could be done. And perhaps the most heartbreaking mistake of all is the profound silence that surrounds these issues. Far too many women never bring up these struggles with their doctors. They feel that the topic is too private, or that intimacy after 60 is not important enough to even mention. But by keeping quiet, they miss out on a wealth of simple and effective solutions that could prevent them from enduring years of unnecessary pain and discomfort. Research from the Mayo Clinic clearly shows that women who are able to openly discuss matters of intimacy and self-care with their healthcare providers are far more likely to maintain healthy tissues, to reduce the incidence of infections, and to even feel stronger and more resilient emotionally. The silence in this case is not harmless, it is a quiet and insidious danger. What many do not realize is that neglecting intimate self-care does not only affect the pelvic area, it can have a significant ripple effect across the entire body, potentially impacting your cardiovascular health, disrupting your sleep patterns, and even influencing your cognitive functions like memory. Your circulation and your hormonal balance are not limited to just one part of you, they are vast, interconnected systems that profoundly shape your overall well-being. And this brings us to a pivotal turning point. In the next part of our discussion, I will show you how small, practical, and everyday steps, some as simple as a glass of water, a gentle exercise, or a short, honest conversation can begin to restore your circulation, strengthen your tissues, and protect your health for all the years to come. These are not overwhelming or complicated changes. They are daily habits that, when layered together, create a solid foundation for a life of continued vitality. Before we move forward, I want to ask you something deeply personal. Which of these common mistakes feels most familiar to you, or perhaps to someone you love? Was it the silence, the acceptance of dryness, the weakening of muscles, or the belief that intimacy no longer matters? Please share your thoughts in the comments section, because I promise you, you are not alone. And speaking up may be the very first step toward your own healing. The beautiful and empowering truth is that even if you have neglected your intimate self-care for many years, your body still wants to respond. The tissues, the circulation, and even your confidence can all begin to recover once you start giving yourself the right kind of consistent support. And the changes you need to make do not have to be overwhelming. They can begin with the smallest, simplest of steps. Something as basic as drinking enough water each and every day helps more than most women can possibly imagine. Proper hydration keeps your tissues supple, it supports your body's natural lubrication, and it improves your overall circulation. Pair that simple act with a 10-minute brisk walk each day, and you are already sending a fresh supply of oxygen-rich blood back to the pelvic area, which is precisely what keeps those tissues strong and alive. Some women also find that adding a gentle, natural moisturizer, such as a high-quality aloe vera gel or a light, nourishing oil, can quickly relieve the discomfort of dryness. Teresa, a retired librarian in her mid-60s, told me that she had thought she would simply have to live with her discomfort forever. But after just 2 weeks of paying close attention to her hydration and using a simple natural moisturizer, she looked at me in utter amazement and said, "Stones, it feels like my body has finally woken up again." Once you begin to feel these small but significant improvements, the very next step is consistency. The muscles of your pelvic floor are the unsung heroes of women's health. They not only provide essential support for your bladder and your uterus, but they also play a major role in the experience of intimacy. When you gently and consciously engage these muscles every single day, even for just 5 minutes while you are brushing your teeth, you are systematically building a foundation of strength that protects you from leakage and can actually increase your physical sensation. Adding gentle forms of movement like yoga or Pilates, or even a simple bridge exercise performed on your living room floor, will enhance both your core strength and your pelvic circulation. Nutrition plays its vital part as well. Omega-3 rich foods, such as salmon, walnuts, and flaxseed, are known to improve blood flow and reduce inflammation, which in turn creates healthier and more resilient tissues. Rosa, a 70-year-old grandmother I once worked with, began adding a spoonful of ground flaxseed to her morning oatmeal and started practicing some light, gentle yoga. She came back to see me months later not only with a report of improved intimacy, but also with less stiffness in her joints and a better quality of sleep. Her story served as a powerful reminder to me of just how interconnected every single part of the human body truly is. Long-term care is where the deepest and most lasting transformation happens. Many women believe that once they stop being sexually active, routine pelvic exams are no longer necessary. But regular checkups remain absolutely essential because the early signs of tissue thinning, pelvic organ prolapse, or infections can be managed far more effectively when they are caught early. Some women also greatly benefit from the use of low-dose vaginal estrogen or other doctor-guided therapies that are specifically designed to restore the health of these tissues. This is not about chasing after youth. It is about protecting your comfort, preventing future complications, and ensuring that your body can continue to support you fully. And perhaps one of the most powerful long-term choices you can make is to actively nurture both your emotional and your relational intimacy. Women who allow themselves to feel deeply connected to a partner, to their friends, and to themselves tend to show better overall circulation, lower levels of stress, and a greater capacity for resilience. Intimacy in this broader sense is not only physical, it is deeply emotional and profoundly protective for your overall health. When you put all of these elements together, the water you drink, the movement you choose, the food you eat, the professional care you seek from your doctor, and the way you nurture your own emotional life, they form a powerful and comprehensive shield against the silent dangers of aging. Every small, positive step you take creates a ripple effect that touches every single corner of your well-being. And here is something to think about. What if these small steps did not just help your intimate health, but also benefited your heart, your sleep, and even your memory? In the next part, I will share the inspiring story of a woman who believed that intimacy was lost to her forever, until she made the courageous decision to take these small but powerful actions. The transformation she experienced may very well change the way you think about your own future. But for now, I want to hear from you. If you could choose just one small step to begin with today, what would it be? Would you start with a glass of water, a short walk, a few minutes of pelvic exercise, or perhaps by making that long-delayed doctor's appointment? Please share it in the comments, because sometimes the smallest of decisions is what sets everything else in motion. There is one particular story that has stayed with me for many years, because it perfectly captures the very essence of what I want every woman watching this to understand. A woman, whom I will call Elena, who was 67 years old, came into my office with a mixture of profound embarrassment and deep sadness. She told me that she had not felt like herself in years. Intimacy had completely and utterly disappeared from her life, not just with her husband, but also with her own sense of identity as a woman. She described feeling completely disconnected from her body, as if the part of her that had once given her such joy and a sense of closeness had simply gone silent. For a very long time, she had thought that this was simply the price of getting older. As we talked, she admitted that she had been avoiding even the most basic forms of self-care. She did not want to touch her own body, she did not want to speak about her issues with dryness, and she did not want to acknowledge the profound changes that were happening to her. "It's just easier to ignore it," she whispered, "than to be constantly reminded of what I've lost." But what she did not realize was that by ignoring her intimate health, she was inadvertently creating more harm, which led to more infections, more discomfort, and an ever-widening distance from both her partner and herself. I explained to Elena that the human body works a lot like a delicate musical instrument. When an instrument is played regularly, cared for, and kept in tune, it produces a beautiful and resonant sound year after year. But when that same instrument is left untouched in a dry, dusty corner, its wood can crack and its strings can become brittle. Intimate self-care is like the regular tuning and gentle playing of that instrument. The tissues need healthy circulation, the muscles need gentle strengthening, and the body as a whole needs consistent attention in order to remain healthy and responsive. Neglect is what allows that fragility to grow. That metaphor seemed to strike her very deeply. She later told me that she had not thought of her body as something that could still produce beautiful music even after menopause. Together, we began with the very smallest of steps. She started to increase her daily hydration, she began using gentle moisturizers, and she incorporated 5 minutes of pelvic floor exercises into her morning routine. She started to walk daily with her husband, not just for the sake of exercise alone, but as a way to share time and to rebuild their connection. Within 3 months, Elena noticed fewer infections, she had significantly more energy, and most importantly, she began to feel like herself again. Her husband later confided in me that she smiled more, she laughed more, and she carried herself with a sense of confidence that he had not seen in many years. The intimacy that eventually returned to their relationship was not just physical, it was deeply emotional, a powerful and poignant reminder that vitality does not have an expiration date. Her story is not a rare one. I have seen countless women in their 60s and 70s rediscover themselves in this very same way, and it always reminds me of just how incredibly resilient the human body truly is. The science fully supports this as well. Studies have repeatedly shown that women who maintain healthy circulation, good muscle strength, and even gentle forms of intimacy after menopause not only protect their pelvic health, but also experience better quality of sleep, stronger memory, and a reduced risk of heart disease. It is as if caring for this one intimate part of the body unlocks a cascade of benefits across the entire system. For Elena, the greatest change of all was not just the physical comfort she regained, it was the way she saw herself. She once said to me, with tears of joy in her eyes, "I honestly thought that intimacy was gone forever. Now I know that it was only waiting for me to remember that it still mattered." Her incredible transformation serves as a powerful reminder that self-care after 60 is not about clinging to the past. It is about creating a present in which your body continues to support you, where you feel vibrantly alive, deeply connected, and wholly worthy of your own attention. Just as a well-cared-for instrument can produce beautiful music in every season of its life, so too can a woman's body thrive at every single stage of her life. And here is where I want to leave you with a thought to carry into our final part. If neglecting your intimate self-care can quietly take away your health and your joy, then what might be possible for you if you were to embrace it with intention, even starting today? In our last section, I will bring everything together, the key lessons, the practical steps, and the hopeful reminder of why your body at any age deserves to be cared for. But before we move forward, I would love to hear from you. Do you see a part of yourself in Elena's story? Have you felt as though your own instrument has been left unattended for too long? Please share your thoughts in the comments, because sometimes, admitting it out loud is the very first step toward healing. We have traveled a long way together in this conversation, and by now I truly hope that you see something with absolute clarity. Ignoring your intimate self-care after the age of 60 is not a harmless act. It does not just mean less physical closeness with a partner or fewer moments of personal pleasure. It can mean tissues that weaken, circulation that slows, infections that rise, and a sense of confidence that quietly fades away. But we have also seen the other side of this story, the hope, the resilience, and the profound truth that your body, even after menopause, still possesses an incredible capacity to heal and to thrive, if you simply give it the right kind of care. Think back to what we have covered. We began by uncovering the hidden dangers of neglect and how stepping away from intimacy can silently create a cascade of health risks. Then we looked at the common mistakes that so many women make, believing that intimacy no longer matters, dismissing dryness as a mere nuisance, allowing the pelvic floor to weaken, and remaining silent with their doctors. These mistakes are not signs of personal failure, they are signs of how little our society has historically spoken to women with honesty and compassion about the processes of aging and intimacy. But that silence does not have to continue. We then explored the practical, actionable steps that can truly change the story. It can start as simply as drinking more water, walking each day, or using a gentle, high-quality moisturizer. It can grow into a practice of strengthening your pelvic floor, choosing foods that support your circulation, and practicing movements that keep your body feeling alive and responsive. And it can eventually become a long-term commitment to regular checkups, to considering safe and effective medical support when it is needed, and to nurturing the deep emotional connections that make you feel whole. Every single one of these choices is well within your reach. And finally, we heard Elena's inspiring story, a woman who believed that intimacy was lost to her forever, only to rediscover not just her physical comfort, but also her confidence and her joy. She learned, as I hope you have today, that self-care is not about turning back the clock, it is about embracing the present, honoring the magnificent woman you are right now, and actively protecting your future. So here is what I want you to remember: your body has not given up on you. Even after 60, even after menopause, your tissues will respond to care, your circulation will improve with movement, and your confidence will grow with your own attention. Just as you brush your teeth to protect your smile, or take a walk to protect your heart, tending to your intimate health is a profound way of safeguarding the very life you want to keep on living. I want to challenge you with one small manageable step today. Maybe it is filling up a water bottle and making a commitment to actually finishing it. Maybe it is taking 10 minutes to walk around the block. Maybe it is pausing for a quiet moment of self-care that you have been avoiding for years. Or maybe it is picking up the phone and finally scheduling that long overdue appointment with your doctor. Whatever it is, please choose one thing and begin. Because the very moment you decide that your intimate health still matters is the moment you open the door to a future of strength, comfort, and freedom that can carry you for many years to come. Fifth message has spoken to you. I would be so grateful if you would share your thoughts in the comments. Please tell me what step you are ready to take, or what part of today's conversation touched you the most. And if you know another woman who needs to hear this message, please share this video with her, because we heal and we grow stronger when we remind each other that we are not alone. And if you have not yet, I warmly invite you to subscribe to this channel. Every week I share new, evidence-based insights to help women over 60 protect their health, nurture their confidence, and embrace the fullness of life. You deserve nothing less. And before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care.